All right, let's dive in. Today, we're tackling something that sounds pretty straightforward at first glance, an abnormally large kidney in dogs and cats.
Right, renomegaly.
Exactly, renomegaly. But as we found in the materials we've gathered for this deep dive, it's actually, a critical clue to a much bigger health picture.
Mm-hmm.
We've got a bunch of articles, some study guides here.
Yeah.
They really dig into why this happens, what it means for the pet, and how vets figure out what's really going on.
And what can be done.
And what can be done, yeah. So our mission today is to unpack all that. We want you to get what renomegaly really signifies, why it's such a big deal for vets, the potential causes, the diagnostic steps, treatment ideas, all based on these sources.
It seems simple, just a big organ, but the reality, as you said, is way more complex and important.
Definitely. So starting right at the basics then, what exactly is renomegaly? I mean, large kidneys, obviously, but clinically.
Yeah, clinically it means one kidney, or sometimes both, are measurably larger than they should be for that animal. And that size difference, well, sometimes a vet can actually feel it during a physical exam, careful palpation of the abdomen.
Right.
Or, more definitively, it's seen and measured using imaging like X-rays or, more often, ultrasound.
Gotcha.
But here's the crucial bit from the material. Renomegaly isn't a disease in itself, it's what we call a clinical finding.
A signpost.
Exactly. A signpost pointing towards some kind of underlying problem, some pathological process happening in or around the kidney that's causing that size increase.
Okay, so it's like the body waving a flag saying, hey, look over here.
Mm-hmm.
If it's just a sign, though, why is it considered so significant? Why the immediate need for a full workup?
Well, it's a really strong indicator of active kidney pathology. Something's going on right now.
Not just an old change.
Usually not, no. It suggests an ongoing process affecting the kidney tissue or its structure, and often these processes are pretty serious, can even be life-threatening.
Wow.
So because of that potential seriousness, finding renomegaly isn't something you just, note down and forget. It absolutely mandates a thorough investigation.
You have to find the why.
You have to find the why. Because the treatment, the pet's outlook, how urgently you need to act at all, depends entirely on what that underlying cause is.
Makes sense.
And the enlargement itself can mess with kidney function. It might trigger acute kidney injury that's a sudden severe problem, or it could contribute to chronic kidney disease over time.
Right.
Plus, some causes, like a sudden blockage or maybe lymphoma, they need super urgent attention to even have a chance of saving the kidney or the pet.
And you mentioned it could be systemic, like affecting the whole body.
Yes, that's another key point from the sources. Renomegaly can be how a body-wide disease shows up. The kidneys are just one target. Think things like FIP in cats, or lymphoma, which can be widespread, or amyloidosis.
So seeing large kidneys might be the first big clue about something happening everywhere else.
Precisely. It can open up a whole different line of investigation.
Okay, so it's a clear signal. Needs fast attention. But how does a kidney actually get bigger? What's physically happening inside?
Yeah, good question. The sources list several different ways this happens. It's not just one thing.
Okay.
One common mechanism is just straightforward inflammation and edema. Swelling.
Like from an infection?
Exactly.
Yeah.
Like a bacterial infection, acute pyelonephritis. Or other inflammation, maybe like leptospirosis in dogs, which causes acute interstitial nephritis. You get inflammatory cells rushing in, more blood flow, fluid buildup. The kidney just swells up. Can happen pretty fast, too.
Okay, inflammation. What else?
Another major one is obstruction. If urine can't get out.
Ah, like a blockage.
Yeah, maybe a stone stuck in the ureter, the tube leading from the kidney to the bladder. Or a stricture, a narrowing. Or even something outside pushing on the ureter, urine backs up.
And kidneys swells with urine.
Pretty much. It causes hydronephrosis. The collecting part, the renal pelvis, balloons out. The whole kidney can become like a fluid-filled sac over time.
Right, hydronephrosis.
Yeah.
Got it.
Then there's infiltrative disease. This is where the kidney tissue gets invaded by, well, stuff that shouldn't be there.
Like cancer cells.
Cancer is a big one, yeah. Neoplasia. Lymphoma is common, and it often hits both kidneys, making them diffusely large.
Oh, okay.
Then you have primary kidney tumors, like renal cell carcinoma, more common in dogs, usually just affects one kidney.
Unilateral.
Right. Or cancer that's spread from somewhere else, metastatic cancer. Or amyloidosis, where abnormal proteins build up.
You mentioned that earlier. especially in Abyssinians.
Yes, particularly in the medulla in Abyssinian cats with amyloidosis. And another one for cats is FIP, the dry form, which causes granulomas, little nodules of inflammation that infiltrate the kidneys.
Okay, so infiltration, that's number 3.
Number 4 would be cystic disease. Think polycystic kidney disease, or PKD.
The Persian cat thing.
Exactly. Notorious in Persians, it's inherited. Fluid-filled cysts develop and just keep growing, slowly replacing the normal kidney tissue. Often makes both kidneys large and kind of lumpy, irregular.
Progressive, then.
Very much so. Then number 5 is interesting. Compensatory hypertrophy.
Compensatory, meaning making up for something.
Precisely. If an animal loses one kidney or one kidney isn't working, the other healthy kidney gets bigger. It hypertrophies to take on the extra workload.
So a large kidney isn't always bad news in that specific case.
Well, it still fits the definition of renomegaly, but the reason is adaptation, not necessarily active disease in that kidney. It's working harder.
Okay, interesting distinction. Is that all?
One more category, sort of. Sometimes the kidney itself isn't the problem, but it looks big because of perirenal fluid accumulation. Fluid builds up around the kidney.
Around it, not in it.
Right, often between the kidney tissue and its outer capsule. Perinephric pseudocysts are the classic example here, especially in older cats.
Pseudocysts, so not true cysts.
Correct. Just fluid trapped around the kidney, making the whole thing feel and look much larger on ultrasound, even if the kidney parenchyma, the tissue itself, is normal size or only mildly changed. Or you could have a hematoma, blood, or an abscess around the kidney too.
Wow, okay, that's quite a list. Inflammation, obstruction, infiltration, cysts, compensation, or fluid around it. That's a lot to sort through.
It is.
You mentioned some tend to affect one kidney, others both. Is that difference unilateral versus bilateral a really helpful starting point for diagnosis?
Oh, absolutely. It's one of the first major branching points when you find renomegaly. Helps narrow things down quite a bit.
Okay, so what points towards unilateral, just one kidney being large?
Usually it suggests something localized to that kidney or its drainage. The sources say hydronephrosis, that urine backup, is probably the most common significant cause of unilateral enlargement.
Makes sense, a blockage on one side.
Exactly. Other big ones are a primary renal tumor, like that renal cell carcinoma we talked about, or a large abscess or granuloma just in that one kidney, a big solitary cyst, a hematoma, or that compensatory hypertrophy we just discussed, one big kidney because the other one's missing or shot.
Okay, so focal issues mostly. What about bilateral, both kidneys enlarged? What does that suggest?
Bilateral usually points towards something more systemic or a process affecting both kidneys diffusely.
Like the infiltrative stuff.
Often, yes. Lymphoma is a classic bilateral cause. Amyloidosis. Also, conditions that inherently affect both kidneys, like polycystic kidney disease.
Right.
Or acute injuries hitting both kidneys simultaneously. Maybe certain infections like bilateral pyelonephritis or leptospirosis. Or toxins like the early stages of antifreeze poisoning.
Ethylene glycol, yeah.
Right. FIP in cats, the dry form, typically causes bilateral changes too. And those perinephric pseudocysts in older cats. Usually bilateral.
Okay.
Even some endocrine things like Cushing's disease or acromegaly in cats are mentioned as sometimes causing bilateral kidney enlargement, though maybe less commonly the primary finding.
That's a really useful split, unilateral versus bilateral. Helps frame the possibilities. Now, besides the vet actually feeling a big kidney or seeing it on an image, what might an owner notice at home? Are the signs obvious?
They can be really variable. That's the tricky part. Sometimes, especially if it's just one kidney affected or it's early days, the pet might seem perfectly fine. No signs at all.
It's symptomatic.
Exactly. But if the underlying cause is messing with kidney function or causing pain or inflammation, then yeah, you'll likely see signs.
Like what? General stuff?
Often general stuff first. Lethargy, just seeming tired, not eating as much, maybe losing weight.
Yeah.
Vomiting or diarrhea can happen too.
Okay.
A really common one, a classic sign for many kidney issues, is increased thirst and urination. PUPD, we call it. Owners often pick up on that the water bowl emptying faster, needing to go out more.
That's a big flag for kidney problems in general, right?
Huge flag. You might also notice their belly seems bigger, or maybe the urine looks off color.
Anything less common?
Lameness is mentioned, but rarely. Sometimes linked to bone changes from severe chronic kidney disease that might have developed from the underlying renal problem, maybe some tumors.
Interesting. And what would the vet find on exam besides potentially feeling the large kidney?
Well, definitely feeling that abdominal mass or noting pain on palpation is key. But they'll also check for other signs linked to kidney dysfunction, dehydration, pale gums suggesting anemia.
Anemia is common with kidney
You're
disease.
very common with chronic kidney disease, yeah. The kidneys help make red blood cells. They might also see sores in the mouth, oral ulcers, or smell that particular bad breath uremic halitosis.
From waste products building up.
Exactly. Waste products the kidneys aren't filtering out properly.
Okay, so the signs can be subtle or severe. Really highlights why those regular vet checks are so important, where they do a full physical.
Absolutely. Palpation is key.
So once renomegaly is suspected or found, walk us through the diagnostic journey. How does the vet get from, big kidney, to figuring out which of those many causes it is?
It's definitely a step-by-step process, like detective work. First, confirming it is a kidney, not something else nearby in the abdomen.
Right.
It starts almost always with a thorough history from you, the owner.
Asking lots of questions.
Lots of questions. What signs have you seen? When did they start? Any chance of getting into toxins, like antifreeze? Where has the pet traveled? Vaccination status, especially for lepto in dogs? Any medications? And the breed, is it one prone to kidney issues, like Persians with PKD?
Got it. History first, then the exam.
Then a very careful physical exam. That abdominal palpation is critical, assessing size, shape, is it smooth or lumpy, firm or soft, symmetrical, painful. Plus checking overall hydration, gum color, listening to the heart and lungs, just getting the whole picture.
Okay. Then labs, I assume, blood work, urine tests.
Indispensable. Laboratory diagnostics are next. Standard blood tests is CBC, or complete blood count, and a biochemistry panel.
What are you looking for there?
Signs of kidney damage or dysfunction. Are the waste products like BUN and creatinine elevated? What about SDMA? That's a newer marker that can pick up kidney issues earlier sometime.
Right, SDMA.
Checking electrolytes. Is potassium high? That can be dangerous. Is phosphorus high? Is the pet acidotic? Looking at white blood cells, high counts could mean infection, inflammation, maybe even lymphoma. And checking for anemia, like we mentioned. Protein levels, too. Sometimes they hint at specific diseases like FIP or lymphoma.
Okay, lots in the blood. What about urine?
Urinalysis is just as crucial. First, urine concentration, the specific gravity, or USG. Damaged kidneys often can't concentrate urine well, so finding dilute urine when the blood work shows waste buildup is a big clue.
Inappropriately low USG.
Exactly. Then, looking for protein in the urine proteinuria, we can measure it with a UPUC ratio to see how significant it is, and examining the urine sediment under a microscope.
What can you see there?
White blood cells, bacteria suggesting infection, maybe crystals, and importantly, casts. These are like little molds of the kidney tubules. Finding WBC casts, white blood cell casts, is specifically highlighted in the sources as a strong pointer towards pyelonephritis, infection within the kidney.
Ah, okay. Not just bladder infection.
Right, indicates the kidney itself is involved. And if infection's suspected, a urine culture is definitely needed to identify the bacteria and guide antibiotic choice.
Any other specific tests?
Sometimes, yeah. Depending on suspicion, maybe testing cats for FeLV if lymphoma is on the list, or checking leptospirosis antibody titers in dogs, or running serum protein electrophoresis if odd protein levels suggest FIP or myeloma.
Okay, history, exam, labs. What about actually seeing the kidneys? Imaging.
Imaging is almost always essential. Radiographs, x-rays can confirm the kidneys look big. There are actual measurements comparing kidney length to the size of a vertebra, like L2.
Like 3 times L2 in cats, 3.5 in dogs, something like that.
Yeah, those are the general guidelines mentioned. X-rays can also spot certain types of kidney stones or check the lungs for signs of cancer spread if neoplasia is a concern.
But ultrasound is the main tool.
Ultrasound is described in the sources as the gold standard here. It gives such a detailed view inside the kidney.
What can it show you?
The internal structure, the cortex, medulla, the renal pelvis where urine collects. This detail is key to differentiate causes. Are there cysts? Is the pelvis dilated, suggesting hydronephrosis? Is there a solid mass? Does the tissue just look diffusely weird, like it's infiltrated? It can also see fluid around the kidney, like those pseudocysts.
And you can guide needles with it.
Exactly. Ultrasound is crucial for guiding sampling procedures, which brings us to
Procedures. Getting a sample.
sometimes needed, yes. An ultrasound-guided fine needle aspirate, or FNA, is common. A small needle takes a sample of cells.
What's that good for?
Great for diagnosing things like cysts, you get fluid back, or an abscess, you might get pus. And very good for confirming lymphoma, you'll see those characteristic cells.
But not for all tumors.
Right, there's a really important caution in the materials. Generally avoid FNA for suspected primary kidney tumors like renal cell carcinoma.
Why is that?
Risk of seeding, spreading cancer cells along the needle path.
Ah, okay. So if FNA isn't the answer or isn't safe.
Then a renal biopsy might be considered. It's more invasive, takes a small piece of actual tissue, not just cells. Needed for diagnosing certain things definitively, like specific types of glomerulonephritis or amyloidosis, where you need to see the tissue structure.
Wow, that's a really thorough workup. Covers all the bases from talking to the owner right down to looking at the cells. So let's say you've done all that. You've pinpointed the cause. What about treatment? Is there like a standard renomegaly treatment?
Absolutely not. And the materials is very firm on this. Treatment depends entirely on the underlying cause you just worked so hard to find.
Okay,
You treat the primary disease, not the large kidney itself.
but there must be some general support if the kidneys aren't working well.
Oh, for sure. Supportive care is almost always part of it, especially if there's kidney dysfunction. Things like IV fluids for dehydration or to help flush the kidneys, managing those electrolyte problems like high potassium, correcting acidosis, medications for nausea or appetite loss, nutritional support.
Like a special kidney diet?
Yeah, often a therapeutic renal diet if the kidney values, like creatinine, are up. And, crucially, avoiding any drugs that could potentially harm the kidneys, further nephrotoxic drugs.
Right, so that's the supportive base. What about specific treatments for the causes?
Okay, so if it's hydronephrosis from a blockage, you need to relieve that obstruction surgery, maybe placing a ureteral stent. If it's a bacterial infection like pyelonephritis, it needs antibiotics, often for quite a long time.
Makes sense.
For FIP, the sources mention the newer antiviral drugs, like GS441524, being highly effective, which is huge.
That's amazing progress for FIP.
It really is. For lymphoma, it's typically chemotherapy. For a unilateral primary tumor, like renal cell carcinoma, if it hasn't spread, surgery to remove that whole kidney and nephrectomy can potentially be curative.
Wow, remove the whole kidney.
If the other one is healthy and functioning well, yes. For things like PKD or amyloidosis, treatment is often more about managing the resulting chronic kidney disease supportively, though colchicine is mentioned for some types of amyloidosis, possibly to slow it down.
So really tailored to the specific diagnosis.
Completely tailored, and that means the prognosis, the outlook, is also all over the map.
Highly variable.
Extremely variable. Depends on the cause, how bad the damage is when caught, and how quickly and effectively you can treat that specific cause.
So some can do well.
Yeah, prognosis can be good for things like an uncomplicated infection treated early or a blockage fixed quickly before permanent damage sets in.
But others, not so good.
Often guarded for progressive things like PKD or chronic inflammation or many cancers. And prognosis can be poor if it's severe disease affecting both kidneys badly or an aggressive cancer that's already spread.
And what happens if it's not managed well? Complications.
Yeah, definitely. The big risks are progression to irreversible kidney failure, acute or chronic, severe uremia, making the pet feel awful, ongoing pain from obstruction or inflammation, infection potentially leading to sepsis, rarely kidney rupture or bleeding, spread of cancer, and those dangerous electrolyte imbalances or severe anemia. Lots of potential downsides if the underlying cause isn't addressed.
It really is incredible how that one initial observation, hey, this kidney feels big, kicks off such a complex diagnostic and therapeutic cascade.
It really does.
So I guess the main takeaway from this deep dive, pulling it all together from the sources, is that renomegaly itself isn't the illness, it's that critical red flag.
Exactly. A warning sign.
A warning sign that demands that thorough investigation using the history, the exam, the lab work, and especially imaging like ultrasound to find the true culprit.
Couldn't have said it better.
Because ultimately, how the pet does, the treatment success, it all comes down to identifying and tackling that specific underlying cause.
Precisely. And maybe a final thought to leave folks with. It really underscores how central the kidneys are to everything in the body, doesn't it?
Yeah, definitely.
They do so much more than just make urine fluid balance, electrolytes, blood pressure, hormones. Recognizing when they're in trouble, like seeing they're enlarged, and then really digging up to find out why, it can make such a huge difference to that pet's quality of life and how long they have. It really pays to investigate these things properly.
A powerful reminder of just how vital these organs are. Well, this has been fascinating, really shedding light on what goes into understanding enlarged kidneys. Thanks so much for joining us on this exploration of canine and feline renomegaly. Keep asking questions, stay curious out there, and thanks for diving deep with us today.